In this conversation, a quote from an editorial over the weekend in the Wall Street Journal. Let's put this up on the screen. They say, the awful irony of this new Obamacare health system is that all adults now enjoy mandated pediatric vision benefits, even if they don't have kids, but parents can't take their daughter to an expensive children's hospital if she really gets sick. Isn't it true, if I may, let me ask the question, isn't it true that to meet the increased cost of this mandated coverage, all of these expanded benefits, that a lot of parents or a lot of people are not going to be able to use the hospitals and doctors that they currently have?
So here's the reality of this situation. There are insurers who are offering narrower networks, right?
Under Obamacare.
Right. So in the exchanges, there are people who are offering narrower networks under the new law, right? And you pay less for those plans. You can pay more for a plan that has a larger network. That is the issue here. There's choice in the market. People pay more for better benefits. Now, I think a really important point here is that the vast majority of people in the insurance exchanges have never had health insurance before. So they're having a new choice here, which expands health care coverage for them. There are some people who had health insurance who are going into the exchanges, and they face an option here, which is, just like conservatives have been telling us for a long time, that you should have options, and if you want more expensive care, you should pay for it yourself. That is the situation that exists here.
I get the point. I don't think there's any question if you're currently uninsured and you can get health insurance coverage, you're better off.
Which at the end of the day will be the vast majority of people in the exchanges.
The question is whether or not the people who currently have policies are going to get better coverage or not. What about this question as to, Neera says, okay, look, there are bronze, gold, silver, and platinum, and the fact is if you get a cheaper plan, you have less choice.
Market are finding that the premiums are going up. On average, people have looked at this very carefully. On average, people that are in the individual market today buying insurance, paying premiums, are going to see about a 30 to 50% increase in their premiums for worse coverage. Higher deductibles, no, with the subsidies.
That's not accurate.
And people that are young and healthy are going to see 50 to 100% premium increase.
And that brings me to the final point I want to discuss here, and that is this question of whether or not Obamacare has massive income redistribution. Neera, is it not the case that younger, healthier people are going to pay more than they currently do? You got to let me ask the question.
I didn't say anything.
You're warming up.
Ready.
That young, healthy people are going to pay more than they currently do in order to subsidize the extra benefits for older, sicker people. Isn't that income redistribution?
Let me be crystal clear about this, because I think there's been a lot of misinformation here about broad statements about younger, healthier people. The truth is, the people who have health insurance today, 85%, the vast majority of people have employer-based coverage. That's staying in place. Medicaid, Medicare, that's staying in place. You're talking about the people today who have health insurance in the individual market, which is 5% of the entire system. We're talking.
That's 15 million people.
I appreciate it. And you're saying that some people may have to pay a little bit more. And the idea of the Affordable Care Act is that they have a much better health care plan. Because the challenge we have in this whole discussion about the challenge we have in this whole system.
But it sounds like what you're saying is younger people are going to pay more to subsidize older, sicker people.
I'm not saying they're going to pay more for subsidies. It really depends. It depends on their income and a whole variety of issues. A lot of younger people are seeing a much better deal in this whole system. The problem is you're talking about issues where there's a big question about whether younger people should actually have a much better deal in the system because they're going to get pooled with a lot of other people.
Jim, is it a better deal? Final word, is it a better deal or not?
It's a much worse deal. People today, if they're young and healthy, can get relatively inexpensive insurance in the open individual market. You're right about income redistribution, though. If you think about it, it's $250 billion a year in Medicaid expansion and the subsidy structure that's basically being paid for from people on Medicare through Medicare cuts and a lot of tax increases. If you want to know what the bill is really about, people in their most honest and candid moments will admit that it's basically taken $250 billion a year out of taxes and Medicare and moving it into the Medicaid expansion and the subsidy structure. This other premium subsidies are also occurring between the young and the old. but it is a massive, massive income redistribution.
It's just not fair to say that they're not getting a better health care plan. That's the challenge with the individual market today, to act like it's a good plan, people have good systems. The challenge right now is it's not really insurance for a lot of people, because when you get sick,